All right. I'm super excited to be here with Dr. Gupta. Hey, congratulations. The Two Comma Club. Wow, how does it feel? $1 million dental implant treatments, just a little over a year. How you feeling?
Feels good. We have been trying to build a practice around larger cases, and definitely you guys have helped a lot to move the practice in the direction. So yeah, it feels great.
I love just to dive in a little bit to your journey, your experience, but let's take a step back before Dental Implant Machine, before, you even became a doctor. Talk to me about what inspired you to get into dentistry and give us a little bit of your backstory, where you went to school, that type of thing.
So first, I went to dental school in India. I think I started dental school when I was 16 years old back there.
Wow. Wow, that's amazing.
Um, so I think when I got into it, I did not really know so much what I was getting into, but as I learned more and as I started liking it more, I became more and more passionate about what dentistry is about. And I love the patient care part, but I also like the technology part of dentistry. So yeah, that excites me, and then that has helped a lot to grow and to get us where we are now.
Yeah, absolutely. Now, you started in India.
Yeah.
Tell me about that journey coming to the US and, having a practice here. What was that like?
Yeah, so when you do dental school in India, and if you come here, you have to go to school a few more years
Mhm.
to get license. And I think which was a great opportunity to learn the system here and then to start learning how to interact with patients here, the different treatment philosophies here. So I did that at BU for 2 years, Boston University. And after graduating, I started working for a DSO for a few months, which was an interesting experience. Really, really fast. You see a lot of patients. It was much of a Medicaid-based practice. So we used to see a lot of patients in a short amount of time, which did help a lot with clinical skills and doing things efficiently. But after a year or so, I moved back to Boston and kind of started an office with a friend.
Mhm.
Kind of started working in one of his offices, and then eventually, just over time, started learning new skills. And I think it was 2012. That's when I placed my first implant, and just fell in love with surgery, and slowly started doing bigger cases, bigger and bigger cases.
Now, what was that like? You first placed your first implant in 2012. What
Hmm.
was that journey like from, a single implant to doing all next procedures? Tell me just where did you learn and who did you learn under? I always love to ask that question because there's so many great teachers out there. Where did you learn how to do it and do it well?
Initially, I learned with Dr. Garg implant seminars from
Mm-hmm.
Dr. Garg. And it's a funny story actually. In our dental school, they taught us about implants, but not much, just basic. And they were like, oh, this thing is for specialists, so you don't even have to worry about it. What I wanted to learn was how to restore implants, not how to place them. But when I did his course, it was an 8-day course over 4 weekends. So it was 7.5 days of surgery and half day of restoration.
Okay.
So he's like, what's there in restoring an implant? You take an impression sent to the lab, you get a crown, and then you put it on.
Yeah.
So yeah, it was not like a planned thing, but since I was taking the course, it was very interesting. So step by step, we started with socket preservation, and just step by step, just kept learning more and more and more. So yeah, that's how I started. And I still remember the name of the first patient I placed implant very well. And I was, on call with my friend, calling him every 30 seconds, like, this is happening, this is happening.
Yeah.
Yeah, so that was the first one. But eventually, you place your first one and slowly keep learning. Yeah.
I love that. How many implants at this point in your career? How many do you think you've placed at this point?
I think last few years we are doing around 700 to 1,000 implants a year. So I would say in my whole career I'm around 3,000 or something like that now.
Yeah, that's amazing. I
Yeah.
love I love that. I love that. Okay, so you started and you took the course, which you like the restorative, and then they were doing more surgical, which is kind of ironic, pretty funny with that. Now, talk to me about, I know that we started working together back in 2014, and so it's been just a little over a year. And tell me, before you started working with us, what had you done to try and grow and scale the implant side of your practice? Had you done anything, or was it mainly just referrals or patients or your existing patient base?
No, I mean, with this type of treatment, you can do good treatment and you do get patients from word of mouth, but I think marketing is still needed. You cannot consistently get people who need this treatment. So we have been doing marketing of some sort. When I was working with my friend in his offices, we tried different things. We have tried SEO, we have tried pay-per-click marketing with different companies, Google marketing. We actually also did TV for a little bit. We tried radio. So we have tried a little bit of everything. I think Google marketing was still the most effective for us. And then in this practice, from the time we started, we also do postcards, which kind of work very well in my area. Uh,
Yeah.
so that thing has been going on the side. But yeah, we have tried different things. And before we started working with you guys in 2024, we were working with another company, which in the beginning it worked very well with them. And that has been my experience with many companies. It's like you start, first 3 months is always the period you ramp up, and then it starts
Yeah.
working very well. Then for like 6, 7, 9 months, it works well. And then I think the focus turns to newer clients, and then the team which was working with you suddenly moves to newer clients, and then newer people start taking care of your account, and then slowly it starts going down. So that's kind of what happened with another company which we were working with for past 2 years before that. So that's why I decided to switch and came to you guys.
Yeah. And tell me about when you started working with us. Obviously, you were, I mean, it sounds like unhappy with the previous company. They weren't really, prioritizing you and your practice anymore. And so you made the jump over to us. Talk to me about how that jump was and really how the experience has been over the last, year and some change here working with us.
Yeah, it has been great, much more consistent. I have the same account manager in India since the beginning, and I see her every few weeks. I just had a meeting with her a few minutes ago.
Yeah.
So, and then I think you guys have been a lot more receptive to ideas. If we want to change something, if you want to, let's say we try the deposit for appointments. So there was no like friction. They were like, okay, let's try it out and see how it goes. And whenever I want to change the spend or we want to change some strategy or something like that, so I get good response, and then we tried different things. So it has been much more consistent and engaging, and having the same person definitely helps too.
And you mentioned India, so I want to talk about that. How has it been? Because India has, she, like many people on my team, have a wide range of experience and knowledge. She's worked in the office,
Mhm.
she's also called patients on our side, and now she works directly with you. How has having somebody with that type of experience helped you and your team out as you've been navigating and trying new things out over the last year?
I mean, definitely, she has been great. As I said, whenever I want to change something or if we want to track some things down, she's definitely is like, let's look into this. There was a time I was like, let's start sending newsletter every month, and then she will be onto it, and just every month it will be ready, to be sent out. I'm the one
Yeah.
who sometimes slack a little bit in checking them, but yeah. Yeah, but she has been pretty good with that, and yeah, just the whole experience she brings that has been really helpful.
She told me about that newsletter, and I don't want to share any of your secrets if you don't want to share any of your secrets, but do you mind telling people just a little bit about that newsletter and what you do with it?
So I send some of my recent cases to India, and then she puts together a little like informational newsletter that we email out to patients. It just kind of helps people who have been for a consult before and then haven't made a decision that time, just to kind of think about it, revisit it, and sometimes they end up calling us from that. So yeah, that's
I
a
love that.
good thing. Yeah.
Yeah, and the cool thing about that is that you said it right there. You take your new patients, so every month you're getting a new newsletter, you're getting new patients,
Mhm.
and it's just more and more social proof, more and more lives changed,
Yeah.
and really being able to tell and show patients that, hey, this was somebody like you, and now they're like this, and this could be you too, right? And I love that you're doing that, and it's just something a little bit extra, a little bit different to really help your practice stand apart and set yourself apart in what continues to be an increasing market, increasing competition. So
Yeah.
that's phenomenal. I love that. I always like to ask this question. Tell me about the one smile reveal or the one patient that just sticks in your mind? That one patient that they just like, whatever happened, their story, their journey. Tell me the patient that you remember the most, that you helped transform their life. I
Uh,
know there's been a lot,
yeah,
so
I think there's more,
take a
more than
second. Yeah,
one.
yeah, take a second.
Yeah, there are more than one, and I think we are in this profession, especially the type of work we get to do, is like a privilege. There was this patient not too long ago. We finished his case, and then he originally went to like the big chain. He paid everything, and then he had a bad case of scoliosis, so his back is really, really bent. So they said we cannot do anesthesia here, so they kind of ended up not doing his case, and he came to us, and I was like, okay, I'll do it because I do my cases mostly in oral sedation, so the risk is much, much lower. Took about a year or so to finish his case just because the complex nature of his condition. Every time we had to get a CT scan, he had to go to his hospital to get a CT scan because he could not fit in our machine.
Yeah.
And yeah, it was just a experience for all of us. The patient, he was like, you can see he was, trying to help us out as much as he could, and then we were all trying to do it. But when he finished, he was just like always super positive in the whole thing. And then yeah, when he finished, everyone was just so happy. So he's yeah, that's one of the cases I'm, always think about whenever I was like things are not going well or something. Yeah,
Super proud of that one. I mean, it sounds like there was a lot, not complications because of what you were doing, but just complications because that's a very, I mean, the patient just had some health issues, right? And I
yeah,
think it's so important what you mentioned. He had been to a bigger chain, he had been to somebody else. And a lot of patients do that, right? They'll go to somebody, they'll go to a bigger chain, they'll go to some of these big implant centers, and they really don't provide that personal quality of care that you can do in your office. And you guys can really work with them to help them out and to figure out, okay, like there's a limitation here. We can't scan because of what's going on, but we can figure this out, right? That's awesome. That's really, really cool. Okay, two more questions for you.
hmm
The first question, how has your team benefited from just the experience working with India, the training, the closing side of things? How's your team and just your guys' ability to close more cases? What's that experience been like since working with us?
So definitely the recommendations which we have got from India have helped. So one thing was in the past we used to charge patients for CT scan, and then with working with you guys, we started trying to just do that in the first visit, and
Mm-hmm.
I think that has taken some friction off. Before our thinking was a patient who don't want to pay for CT scan probably would not want to do the treatment, but
Yeah.
I think just doing that right away, that has taken some friction off, so I can see what the patient need, and then we can give a more confident treatment plan. So from I think clinical part, that was a good recommendation that has helped. And then there's small things about follow up with patients. I think your team has been very communicative too. If there's a problem with the patient, they send us a message quickly, and we reply to the message. So that has been great. With respect to presenting treatment, I'm sure our office manager and then the other staff has talked to India several times to
Mm-hmm.
go over things, and then yeah, I can confidently say we are pretty good in presenting treatment, and if the patient will accept, they will accept it here.
Yeah, I love that. I love that, and I love that it really is just a couple small tweaks
hmm
can really make, I mean, the world of difference. Whether it's, you mentioned charging for that scan up front or not, a couple just small things. Same thing on the presentation side can really make a big difference of getting somebody who's contemplating or thinking it over, and then them just saying yes and actually moving forward. So awesome. All right, last question for you. If you were a new doctor and you were looking at using dental implant machine for the first time, what would your recommendation be to that doctor now that you've actually worked with us and we're continuing to help you grow and scale? What would your recommendation be to your former self just starting off in the program? What would you tell yourself?
I would say definitely, give it a try. But also when you try, you gotta keep a 6 month timeline because it does take some time to scale up. But you guys have been great, as I mentioned. The experience has been good, very responsive. So yeah, definitely I would recommend using the DIM.
Awesome. Well, Dr. Gupta, I I really appreciate you getting on with me. I appreciate the conversation and just some of the insights and that patient story, the life that you changed right there, and then the many lives that you have changed. Super excited to continue to work with you and continue to help you transform more lives. And let's do another million,
Yeah.
another Two Comma Club. Does that sound good?
Yeah. Thanks for having me, and thanks for, everything you guys do. I think this partnership is very important for us. And yeah, I also look
Absolutely.
forward to working with you guys for a long time.
Thank you. I appreciate that.